Bebler. I work for Health Partners.
Students connecting with professionals.
My path was a little unconventional.
A networking system.
So I am actually a biology major for my undergrad, and then I went to do a year internship in nuclear medicine, which wasn't for me. It was more of a, it was exciting. I learned a lot, but it was more of a, you didn't do a whole lot. You didn't have a lot of interaction with patients. So after that, I went to work for a medical supply company that provided low air loss mattresses and wheelchair cushions for patients with bed sores. And when I was working there, I did a lot of work with physicians and nurses over the phone, and it was at that time I decided I want to be a nurse. So I went back to school at Rush University in Chicago and got another bachelor's in nursing. And then I worked at Northwestern Hospital downtown for a couple of years, and then went out to Johns Hopkins to work for a year. And then I decided I wanted to come back to Minneapolis where my family was, and felt like it would be a better career move for me, I guess. And then I went back to school to get my master's in nursing at the University of Minnesota. So I finished that, so I had my master's as an advanced practice nurse, as a clinical nurse specialist. So with that, I can prescribe and I can bill. I'm a provider, so I can see patients independently, but I also collaborate with the physician I work with. It is so different for you guys today than it was for us, but you know, my parents just encouraged me to go to college. I really went to college. I didn't really know what I wanted to do. I thought I was going to college maybe for nursing, but when I got there, I realized I didn't have a nursing program. But I stuck it out and just pursued biology. I always loved math and science. You know, I always wanted to do something in healthcare. I thought of becoming a physician, but I guess I never went down that road. I think that's kind of what influenced me to be a nurse. So I work for Health Partners, and at Regis Hospital, we're a level 1 trauma center. And with neurosurgery, we work with brain and spine. So my day could consist of 2 days a week I spend in the clinic where we could see anywhere from 15 to 25 patients. Every morning I see patients in the hospital, I round on them and see how they're doing, and whether it be they need more orders or need to go home, I work with that. I also help in the operating room for certain cases. Every day is a little bit different because of being a level 1 trauma. We take a consult pager, so if something comes into the emergency room, we go down there and see that. So I'd say the excitement of my job is that every day is completely different. It's exciting, it's challenging. I think it's very rewarding as a nurse. I love it. It's very busy. I guess I would say with nursing, I think, I was actually thinking about this the other day when you asked me to come in. I think with nursing, the one thing is that there is so many opportunities as a nurse. I think people think of a nurse as a bedside nurse. You're actually taking care of patients in the hospital at the bedside. But that's not all there is. I mean, there's opportunities for, you can do triage nursing, you can work for medical supply companies, you can work for pharmaceutical companies, you can work for the NIH, the National Institute of Health. There's just school nurses, there's just so many roads to take if you want to be a nurse. There's just so much opportunity out there. But I think that's the uniqueness of a nurse, is that, you know, there's just, the opportunity is just unlimited. I think sometimes it's exhausting to always, you're taking care of people all day, and then you go home and you take care of people. You know, but I would say I love it, you know, it's rewarding, but I would say it's you know, sometimes it's tough. But, and you do see a lot of difficult cases, you know, or patients that are extremely sick or that come into the emergency room that will probably never make it out of there, and I think that's really hard to talk to the families and see the patients. I would say go for it. I think it is a job that you'll always have an opportunity. I don't think you'll ever have to worry about not having a job in nursing. And I say if you love people, taking care of people, you will love it. It's a busy, it's an active job. One thing I think is good, which I wish I had done with my career initially, was, you know, go observe. Ask somebody to work with them and follow them for a day, because I think it gives you a great idea of if it's something you're interested in. I've taken many kids on, not kids, but, you know, adults like you guys. But I think for one who really thought she wanted to be a nurse, she was like, I can't do this. And I think it's a great way to experience whether or not it's something you like. But I just say, you know, follow your dreams, have fun. There's so much to do out there.